We will. Right, well, thank you very much, everybody, for coming to this meeting of End Social Care Disgrace. Our original campaign title was Campaign for a National Care Support and Independent Living Service. We still retain that as a set of demands of our campaign, but our main title is End Social Care Disgrace, and then campaign for something that doesn't exist at the moment, campaign for a national care support and independent living service. We have several speakers here tonight. One of the speakers is Lord Sikka, and he hasn't been able to get into the meeting. So
hello, I'm here.
Oh, you're great. That's great. Thank you.
I am here. Hello, everyone.
Thank you. And I'm sorry you had trouble getting in.
No problem at all. It was just there was extra time in the World Cup.
Right. I think Prem, for some reason the name you're under is Lewis Baker, but I'm going to change your name if you don't mind.
Okay.
Prem, to your real name. So, End Social Care Disgrace. That's a campaign that was set up over 2 years ago now. We have supporting organisations from Reclaim Our Futures Alliance, the chair of whom is here today, Mark. Individual disabled members of disabled people's organisations, including, for example, Disabled Peoples Against Cuts and others, the National Pensioners Convention, the GMB Union, Reclaim Social Care Manchester and Ealing, the Doctors in Unite group within Unite the Union, Greens Disability Committee members, and Keep Our NHS Public, of whom I'm co-chair, and our trade union facing Alliance Health Campaigns Together. So those are the constituent organisations. It's an unbelievably important subject. There's lots of differences of opinion about how we campaign on the terminology. Some people are against the term care and social care. What we've said in our title is End Social Care Disgrace, because one thing we can all agree on is that it's a total disgrace, and it has been for decades. We've got really good speakers tonight, including disabled people, carers, and politicians. And I'm going to go straight in a minute to start off inviting the speakers to address us. Access requirements. Apologies if anybody's given us access requirements. We've had some technical difficulties and we're not sure if we've accessed any such requests. What we do have is that there's the ability to access automatically generated subtitles by clicking the CC button at the bottom of your screen, or indeed to switch it off if you don't want captions. So I hope that's okay. We'll turn on that facility. We're turning off the, is that okay, Lewis? I hope that's okay. We will be turning off the chat function at several people's requests, saying that they find the ongoing chat very confusing to be listening to speeches and trying to read the chat at the same time. And we'll switch that on again when we come to the discussion. We're hoping there'll be plenty of time for discussions at the end of the meeting. We're hoping for the speeches to be finished around 5 minutes past 7, and we'll have half an hour of questions and comments. Please, could you all look after your own muting and be muted when you're not speaking. I didn't introduce myself really, but I'm Tony O'Sullivan. I'm the co-chair of Keep Our NHS Public and part of Health Campaigns Together also. And at the moment, I'm chairing the End Social Care Disgrace Steering Group, which is a great privilege, of course. I'm a retired paediatrician, consultant paediatrician in the NHS, so I spent all my working life working with disabled children and their families, and that indeed was also a privilege. And our task together was to try to get agencies to work together to help support families. I'm going to invite, first of all, Rachael Tomlinson, who's a disabled member of Disabled People Against Cuts, DPAC, active in the Labour Party and also working with Unite. And I hope Rachael will be talking about why we need radical change and what that will look like. So over to you, Rachael. Thank you.
Good evening, everybody. I feel very privileged to be invited to speak about the personal side of social care. I'm Rachael and I live with multiple sclerosis. I'm a retired facilities manager from the NHS. Therefore, I'm quite familiar with the changes that have been made over the last 12 years. I support the MS Society in a number of roles, including co-production and the Living Well programme. I'm regional vice chair for Unite Community North Yorkshire and Humber, and I'm representing DPAC Sheffield this evening. For 12 years, disabled people and people of low income have suffered cruel, disproportionate ostracisation and punishment simply for being who we are, simply for being how we were made, or simply for being people who have become disabled later on in life. This can happen to any of us at any point. It did me. We faced the greatest assault on our well-being in living memory over the last 2 years. Forced DNARs and large numbers died, not to mention many who were just pushed back into social care untested and left to die. Many now are struggling to get the support to meet their basic needs, let alone any extras such as respite care, days out and medical appointments. Unlike medical care, social care has to be paid for, and how much is a postcode lottery and is decided by per council area, depending on what funding is available. They can also take into account your income and any benefits that you may be in receipt of. My friend Susie lives with multiple chronic illnesses and requires care 3 times a day. This has recently been cut back from 15 hours to 10. This now means she can no longer access shopping, medical facilities, or social activities to continue a fulfilling life. She can't even get her hair washed in the time allocated now. 3 in 10 of the 13 million disabled people in the UK live in poverty, which is directly affecting 3.8 million adults and 300,000 children. In addition to this, there are 3 million who are living in poverty also live with someone who is disabled. That means that nearly half of 40 million people in poverty are affected by disability in some way. This leads to disabled people relying on family members and friends to provide their care. The current system is failing them as they have little respite care and support, and they are often financially drained. Those carers are currently saving this government £158 billion a year. Disabled people of all ages and older people are the most at-risk group for being left on the floor frozen or waiting for ambulances for up to 20 hours. With excess winter deaths this year set to break all previous records, it will be the most vulnerable who will die. Indeed, I know a friend who waited 28 hours for an ambulance for a child recently, and I've just pleaded with my elderly mother to increase her lifeline support to ensure that she can, to include response to ensure that if she's ends up on the floor, hopefully she will get picked up. Hospitals across the country are reporting weekly on their no criteria to remain patients, which have been known to reach 200. This means that they're in a hospital bed when they could be in the community or residential care, but there's no spaces. While the system is run for profit and not for patient care, this situation can only get worse. 83% of adult social care services are run by the private sector, a large percentage of which are run by just 4 companies, and the number 1 provider has just recently been valued at 1.2 billion. What can we do? Well, you can join this campaign. Whilst the Labour Party conference passed a motion which included some of the demands of the End Social Care campaign, we are conscious this will still take an enormous effort to deliver what their members so desperately need and want, and not to take the 3 parliaments to deliver, because many of us can't wait that long. They need to bring about a radical new change involving service users, carers and workers in the local community to co-produce the creation of a free at the point of use social care service, which is publicly funded and radically reimagined, offering choice, control and dignity for all, whilst obviously ensuring staff pay and conditions reflect their high value and skills, and also making it more appealing for people to want to join the service. Ultimately, we need to make all our communities more accessible and provide a welfare system fit for purpose. I'll finish on this. It's now literally about survive or die. We absolutely must speak in those terms, lest we minimise the people who are on the bottom of this mess and what they are going through. In the meantime, please check on your friends, check on your neighbours, raise motions within your constituency, Labour parties and unions, write to your MPs and shout from the rooftops, end social care disgrace. Thank you for listening.
Thank you so much, Rachel. That was really, really good. And your call for people to be involved, we'll provide details of how to get in touch with our own organisation at the end in the chat. Of course, what you say about people literally facing death, that was never more clearly exposed than during COVID, with the, I don't know what it was, 45,000 people who died in care homes, and in their own homes, another 20,000. I'm going to go straight, so thank you very much. I'm going to go straight on to Lord Prem Sikka, who has been a really powerful spokesperson for justice in the House of Lords. Welcome, Prem. Thank you for speaking.
Well, good evening, everyone, and it's a pleasure to join such campaigners for social justice. Now, social care is absolutely vital for everyone, because we are all just one serious accident or illness away from needing social care. So it is not something which is for somebody else, it is for ourselves. And when you look at the statistics about the residents in the care homes, you will find that over half the money is spent on people of working age. The majority of people in social care tend to be elderly. So that again means that the issues which we are looking at matter to everyone, and they are vitally important. What's been happening around us is that successive governments have used a well-trodden path to privatization. The standard formula has been degradation of publicly owned healthcare services by starving them of resources. They then become dysfunctional. Then somebody walks in and offers privatization and market-based solutions as the only viable alternative. That has been tried out in the National Health Service, where large parts have really been privatized. The same formula has been applied in social care. Indeed, social care has been the test bed for the neoliberal ideas. As Rachael mentioned, most of the care homes, care beds are now under the control of large corporations. And many of you would have noticed last week, former Prime Minister David Cameron promoting an insurance-based approach to social care. Last year, former Health Secretary Peter Lilly put forward a bill in the Lords arguing the case for social care, for insurance-based social care. And that bill mercifully never got anywhere, but I think they are just testing the water here. Now, social care is under the control of local authorities, which is really a throwback to the creation of the National Health Service in 1948. The sick were farmed off into the NHS and the care went into local authorities. Local authority funding for quite a few years has been squeezed. Between 2009-10 and 2020, local authorities have experienced a 37% cut in real terms in the grants that they receive from central government. That then affects the amount of money which they can spend on social care. As Rachael mentioned, in 1960, it was publicly owned care homes which provided social care, but now 84% of the care home beds are controlled by corporations. there are around 17,000 care homes with 400,000 or so residents. Last year, local authorities received some 1.9 million requests for social care for various periods, and this included 578,000 from working age adults. There is an increase because of austerity, which creates all kinds of problems for people, especially mental anguish. In last year, local authorities spent £26 billion on adult social care, and half of that went to working age adults. Financial help, as Rachael mentioned, is means tested, though Boris Johnson promised us that there would be a new cap of £86,000 off the kind of life spent. And that actually is not good enough, and I will come to that in a moment. The resources which are given by local authorities to care homes are never really reaching the front line of service. The main reason for that is profiteering. Just to give you two examples, Greenwood Homes, which operates care homes, operates on a profit margin of 37%. Avery Healthcare has a profit margin of 41.7%, which means that for every £100 that they receive, just over £60 is reaching the front line for care. Too many care homes engage in financial engineering, especially those controlled by private equity, and they are actually avoiding taxes as well. So they are being funded by taxpayers out of the tax pot, but they are putting very little back. Social care sector has about 1.62 million staff. About 24% of these are on 0-hour contracts. Over 40% of the domiciliary staff are on 0-hour contracts. Now that does not exactly motivate staff to do a great deal. The median wage in care homes is £9.50 an hour, and 165,000 vacancies are out there, and indeed care homes are earning less. Care home workers are earning less than supermarket workers. I have a member of family who's been in care home for many years, and every time we visit or every time we phone, there's a different person we speak to. So there is no real continuity of care, because people come in and they leave fairly quickly as well. So rather than ending privatization, which is siphoning off money in profits, or curbing profiteering by care homes, former Prime Minister David Cameron suggests that people be forced to buy insurance. And of course, the problem here is there is no insurance company which is willing to offer an insurance policy to cover social care. So the novel idea he and other Tories are pushing is that the government should go in the business, either on its own or with an insurance company, to sell social care insurance. This simply is not viable at all. And these are my arguments in a nutshell against that. If you look at the actual cost of care homes, the fees can range anything from £27,000 to £39,000 per annum for residential care home. But if you need nursing support, the fees are between £35,000 and £55,000 a year. So what would the annual insurance premium be to cover that kind of cost for 3, 4, 5 more years? Now, Cameron isn't really forthcoming, but last year, Peter Lilly suggested a number. He said that all people need to do is make one-off payment of £16,000. That would be it. That is just a joke. No way a £16,000 insurance premium would cover you for the costs which I actually mentioned. Now, let us imagine that 16,000 number is realistic for a moment. Where exactly are people going to find this £16,000? Not under their pillow. A quarter of UK adults have savings of less than £100. That is a lifetime savings. 1 in 3 people have lifetime savings of only £1,500. The median household savings are just £12,500. So people at the median level can't afford to pay even that £16,000 insurance premium. The next thing the Tories suggest is that people can offer a charge on their home and borrow the money and make the insurance payment. So let's look at that. The problem here is that the home ownership is declining. In 2003, just over 70% of the homes were owner occupied. The most recent data we have suggests about 63% are owner occupied. But that percentage declines dramatically when you move to ethnic minorities. Black Africans, only 20% of them own their home. They basically live in rented accommodation. Arab people of Arab descent, only 17%, and so on. The younger people are unable to get on the housing ladder. And indeed, when they're getting on the housing ladder, it is much, much later in their age. And what is happening is people are still paying mortgages when they retire. So the idea that you have this kind of a house waiting, which you can just remortgage, is simply not on. And what is also happening is that many grown-up children are unable to get on the housing ladder, so they're living in parental homes. And the idea that you remortgage to generate money means that you're going to start turfing out children after children have to leave the home. Many elderly people I have spoken to are already raising money out of their home through equity release schemes because they can't live on the state pension, which is incredibly low. And their children can't provide the social care. So it simply does not add up, whatever they're trying to do. So the insurance approach would help the ultra rich who have £16,000 or more just sitting under their sink in a kitchen somewhere. The rest of the people will not be able to afford it at all. So we need to do the following. We need to push out corporations from social care. That would just that act alone would release 30 to 40% of extra money, which at the moment is going in profits. We need universal social care, free at the point of need, funded out of general taxation. That is for everybody. And in order to fund it, there are many ways, but since these days people only talk about tax and spend, so let me just suggest a couple of ways. We can simply eliminate the tax anomalies or the tax perks for the rich. Here are some examples. If we taxed capital gains at exactly the same rate as earned income, at the moment they're taxed at a far lower rate, and we also forced the capital gains recipients to pay national insurance, at the moment they pay zero, even though they use social care and the NHS, that alone would generate about £25 billion a year extra. If we tax dividends in exactly the same way as earned income and charge national insurance, that could raise £8 to £10 billion a year. If we reformed tax relief on pension contributions, at the moment, 2/3 of that goes to people who pay tax at the rate of 40 and 45%. The remainder goes to about 2/3 of the workers. Well, that would generate another 10 billion spare. At the moment, national insurance is payable at a rate of 12% on taxable income up to 50,270, but only 2% on income beyond that. Suppose we charge...
Prem, could you just have 1 more minute, please?
Yeah.
Thank you.
So suppose we charge 12% on all the income, that would generate another £15 billion. And this by no means is a conclusive list. The point I'm trying to make is that the money is available. What is not available is the political will. And that is what we have to change by informing each other that we must never, ever accept the argument that we can't afford it. What we can't afford is the misery, the pain for people.
That's a fantastic last message to end on. Thank you very much, Prem. Now, I know you have to leave in a couple of minutes. So I was going to ask if anyone wants to have 1 or 2 questions for Prem before you go, Prem.
I can wait about another half an hour.
Oh, okay. Well, let's take the couple of questions that have come up
Okay.
now, because we're going to have the main question answer after 7 when I think you
Okay.
do indeed have to go. So I've got Sarifa Patel first to speak, and then Rona. We may not get past that, but I've got one other after that. Sarifa, could you unmute?
Yeah, hi everybody. I'm Sarifa Patel. I'm part of Win Visible group for disabled women and that. And my question is, there's a lot of us disabled women, people of colour, who face a lot of institutional racism, which the organisations and local authorities don't like to believe, but it goes on, and that's the reality of our life stories. And then some of us, even me, I was pushed into in 2004 to go into a Sahara homes, a care home, and I didn't want to, but I had good allies who fought with me, and it didn't happen for me. But I wouldn't have had the funding to do that anyway. But it's funny, when they want to do that, they've got the money, but they haven't got the money to give us the direct payment we need to look after our disabled children properly in the home. And I was just wondering whether you, as as a big campaigning group, are going to do something about the discrimination and the barriers that we disabled mothers face, people of colour especially. And we often get put on, and other mothers as well, we often get put onto child protection unnecessarily. And I just think it's really diabolical that they don't want to support us, but they've got the money to put either our children in care homes where they get abused, or us in care homes. Thank you.
Thank you, Sarifa. I'm not sure if that was directly to Prem, but that's the point of this section. But Prem, do you have any comments on that?
Oh, well, thank you. And thank you, Sarifa, for sharing that information with all of us. And it is really heartbreaking to hear what people go through. I think the most important thing is to give visibility to what is ignored and marginalized. Share stories with other people through the media, social media, the print media, and everywhere else, and also mobilize civil society organizations to promote the problems you face and call for reforms. Certainly, if issues come up in the Lords, I'd be delighted to give visibility to these issues, but I think it has to be a never-ending battle, and we all have to unite to make sure that everyone gets the justice they deserve.
Thank you very much,
Thank you,
Sarifa, and thank you, Prem.
yeah.
I'm going to go on. We've only got a couple of minutes. I'm going to take 2 more questions. Rona Topaz, please.
Good evening, everyone. I wanted to ask Prem. I know you're sort of like speaking from the perspective of the House of Lords, but I'm actually more concerned about what's going on in the House of Commons, insofar as particularly since the last general election defeat in 2019, the opposition seems to have been moving further towards the centre right. And I'm particularly concerned that if we were to have a Labour victory at the next general election, it wouldn't necessarily guarantee that social care would be substantially changed in the way that we would all like it to. I don't really believe that the Labour Party are in favour of the increase in capital gains tax, for example, or in finding the money from the sources that you mentioned. I feel like at the moment, I feel that politically things are a little bit hopeless as far as disabled people are concerned, and I'm just wondering what your thoughts are.
Thank you. Over to Prem.
Well, thank you, Rona. I think the world we live in has always been volatile, and that there is always political movement. It is us to make sure that it moves in a direction that we prefer. So, we can't just sit back and just watch others take the initiative. And would we get the kind of social care that I am sort of calling for? Well, there is no invisible hand of fate. It is a kind of fate which we create for ourselves. And the world we live in is always in the process of being made. So what we have to make sure is that it is made in the way that benefits all of us. And that is what we have to do. Would Labour go for capital gains reform? Well, it isn't for lack of trying on my part and many others. I've been quite heartened that for quite some time in the House of Lords, even some Conservative peers have begun to call for taxing unearned income in the same way as unearned income. Of course, there's been opposition as well to every time I speak to that idea. But I think we have to popularize the ideas in such a way that they sort of would appear to many people to be a natural thing to do. And so the point I'm trying to make is that the kind of world we are calling for can easily be provided. Money is there, finance is there. And just to let you know, a few weeks ago, I invited a group called Patriotic Millionaires to give a seminar in the House of Lords, which was attended by a lot of MPs and peers. And these are some of the richest people in the UK. And what was their bottom line message? They were saying to the government, please tax us more. Please eliminate tax anomalies because we want to see social justice. And I was really heartened by their call. So basically, we all need to spread the message that, you know, the kind of things which we are calling for can easily be funded. There's no reason why they can't. A country which can bail out banks, a country which can hand quantitative easing of £895 billion to the City of London. It can fund social care, even if it takes extra 10, 15, 20 billion. That's not a lot of money. All we need to do is give political parties a push. The bottom line has to be, I'm not telling you to which party to vote for, but the bottom line has to be to any political party, do you want our vote? Tell us how you will deliver social justice. If you're not going to deliver it, sorry, we can't vote for you.
Thank you very much, Prem. We're running over. Esme, can you make a very brief question? Is that okay? Sorry to sound rude. But,
no, I'll keep it short. I just wanted to come back, Prem, you were talking about some figures about costs of homes and stuff like that. So I'm in the London Borough of Southwark. There's 3 nursing homes. One has just closed down with a month's notice. One has just been rated inadequate. And the other one, which is a new one, is charging between 1,500 to 1,800 per week, which is £93,000 a year. So I just wanted to update your figures a bit. That was it, short.
Well, thank you. You know, they're kind of, the numbers are quoted are kind of average numbers, not taking account of the peculiarities of any district. Some care homes closed because of bankruptcy, but if we had a publicly owned system, there would be no bankruptcy. There were, you know, people can be paid a decent wage too. All we are going to do is make sure that instead of the money being siphoned off as profits, it is actually used for for the care of patients and residents. So I think that is what we have to, you know, aim for, really.
You're muted, Tony.
You're muted, Tony.
Sorry, apologies to Mike and Carrie. We'll have more questions time after 7:05. Thank you very much, Prem, for joining us today, and I hope it sounds like you're willing for us to keep in touch with you and ask for your help in the Lords. I'm going to go on now to invite Jo Walton to speak next. Jo is the full-time family carer. She works within the Labour Carers Group. She's going to talk about her own long-standing experience and, if possible, some pointers towards what needs to change. So welcome, Jo.
Good evening, friends and comrades. I'm humbled to be asked to speak in such esteemed company, although with all my heart I wish that I did not have the credentials to contribute to this debate. But then I would hazard a guess that the vast majority of us would want as little to do with the care services as possible. Life, however, no matter how careful you are, how well you look after yourself and those that you love, how risk-averse, has an unpleasant habit of throwing curveballs. Whether it's you personally or someone you love, Being thrown into that world where the need for care is the only outcome is like stepping into a maelstrom. And at that point, the very last thing anyone needs is to be worrying about what you can afford rather than what you need. I'm speaking from the perspective of an unpaid carer. My name's Jo Walton. I'm a 24/7, 365 day a year carer for my adult daughter, Sarah. And here she is. It is as well that we've always liked each other's company, because now we are constant companions, night and day. I didn't ask for or seek the role. It became my life at the age of 50, whilst I was enjoying a very satisfying career. Sarah, the focus of this care, didn't expect my change of role either. Nor what hit her. She was a fit and healthy 25-year-old training in midwifery after gaining a degree and enjoying life to the full in the capital. Completely out of left field, a neurological ticking time bomb exploded and she was left within a year unable to move or speak. We have had 18 years of interaction with our clinical commissioning group through a number of different acronyms and just entering another one with the ICBs. Generally, we've had positive interaction with those staff who've understood the care that we've sought for Sarah to support us to maintain her at home, which is where she and we wanted her to be. For those 18 years of intense involvement with the NHS, we've witnessed the slow degradation of services, the increasingly low morale of staff as they're hit with wave after wave of reorganisation. We've also witnessed the fragmentation and the lack of accountability that privatisation causes. In those 18 years, we have never had a functioning care package, despite the NHS funding being there for it. Too often, I've seen brilliant carers move on because they want a job with proper salaries, terms and conditions, and public respect. We have had that care delivered over the over the 18 years by 4 different companies, and our experiences spanned national companies, middle-sized specialist companies, and small local companies. We come across similar issues with all of them. They're very big on promising and small on delivering. During the course of time, we've fallen over a number of issues, and I'm going to give you a flavour of some of our frustrations here. The most personal of data is distributed to a multitude of private providers whilst they decide whether they will bid to do the work or not. Those same providers will promise the earth to get the contract but fail to deliver, and if their failure is questioned, they just dump you. Their failures never result in consequences for them. Then there was the day that we discovered that care delivered within the home is not covered by fire orders, as care is when it's delivered in care homes, nursing homes or hospitals. The staff are told to secure the room with the client in it, and in the case of a fire, leave the building and phone for the fire brigade. How on earth can I go anywhere knowing that? Then there's the total lack of knowledge of, or maybe it's a choice to ignore, the working time regulations of 1998. A 9-hour contracted shift without a break is not legal. I could go on, but time's limited. And I know that we're not alone in our experiences. Care services are broken. They've been broken by the fragmentation brought through privatisation and the raiding of the funds provided for those services so that shareholders get them rather than the quality professional services that the users need. There's no room for profit in care. And we, as Prem's already said, we can't go on accepting that we can't afford a national care service. We can't afford not to have a national care service. To paraphrase Bevan, the need for care is neither an indulgence for which people should have to pay nor an offence for which they should be punished, but a misfortune, the cost of which should be shared by the community. In the midst of attempting to care for someone who is suddenly and devastatingly ill, coming to terms with lost futures for the person that we love and for ourselves, the last thing we need is to find ourselves fighting for adequate care. All parties need to listen to those who are involved, those needing the care, carers, care workers, and finish the work which Bevan began. From my perspective, I'm asking that my lived nightmare is resolved and that my daughter's need for care can outlive my ability to deliver it. because the care that will replace it will be every bit as good, in fact, quite probably considerably better. Thank you for listening.
Oh, Joe, thank you so much. And I don't know how you've packed so much into that time, but apologies for giving you short
Very
shift
well said.
and everybody else. So thank you very much. And I hope there'll be questions for all the panel later on. I'm going to go straight on to Don next. Don O'Neill is a disabled activist and he's an author. He wrote the book, The Lack of Care Act 2014. And he's going to talk about his own experience and that of many disabled people he's spoken with, and also hopefully some pointers for the future. So welcome, Don.
Thanks, Tony. Hi, everyone. I want to tell you about Esther. In her late 60s, had polio as a child and needs a new kidney, and she needs 24-hour care. Now, Esther's care package is delivered by live-in carers, and everything was going well up to about 2018. She was funded £850 a week for her care package, and with that she could have live-in carers all the time. And then one day a social worker came round and said, "Oh, we're going to review your care." And after the review, they said, "Well, you don't need night care anymore. We're going to cut your care from £850 a week to £430 a week." And she said that the social worker said, "At night, what you can do now is just wear a pad." Now, even though Esther's care at night involved more than the toilet, it involved testing her blood because she had diabetes and many other things. That's what happened to her. And so, problem is, Esther had no idea how to challenge this. She had no idea who to turn to, no idea of her rights. And so even with great new laws, they're all very well telling people what their rights are, but she didn't really have the confidence to challenge it either. And so she had no idea what to do. Luckily, and this isn't about me, it's about her, she lived next door to me and she told me what happened. And I got a lawyer for her. And after a battle with the local authority for about 8 to 12 months, not only did they reinstate her level of funding, they increased it. And the problem is, Esther's story is repeated all around the country, and not everyone has a friend next door or someone who knows the system to actually help them get the care they need, because many people don't get the care they need simply because they just don't know how to ask for it, or that they don't get enough care because a social worker pops around and says, "Oh, we're going to cut this, cut that," and they don't have the confidence to ask for it as well. One thing I think every local authority ought to do is have a user-led organisation of adult social care users. And there are 3 main reasons. The first one is advocacy. As I said, it's all very well giving people rights and telling them their rights, but unless they have someone to help them fight for those rights, they're quite pointless. And also when it comes to assessments, many people lose out on their care because the assessment's one-to-one in their home, there's no one else around, and they get intimidated or scared by the social worker. But if they had advocacy from someone who knew the system, they could not only keep the care they have, but also increase the amount of care they get. Another reason why we need user-led organisations is that local authorities often run care badly. They bring in a new initiative, which where I live in Oxford, they brought in the new Oxfordshire Way. And service users, you look at this new initiative and you think, what the hell's that? How much money did that waste? And I know local authorities need more money, but they also need to spend the money they have far better. And I think if user-led organisations were involved on a day-to-day basis, helping them create new services where they run, and also helping them to find out what's actually needed, they could create services that people actually want, and they could create them at a cost that doesn't actually cost as much as it actually does now. And another reason why we need a local user-led organisation is to help people manage their care. Many people can't find carers. They have no idea how to find a carer. And again, under the new Care Act 2014, that kind of information should be given to people. But even if it's given to some people, they have no idea how to use that. A friend of mine, her carer was going to go away for 4 weeks, and she had no idea how to find a carer. And because of that, she just went without care for 4 weeks. But if there was a local group who could help her, she would have got that care and all would have been okay. So I do feel that new laws are great, new rights are great, but people need lots of support to actually get the care that they actually need. And also we do need to have better services run far better by people who know what's needed and how it should be done as well. And I do feel that having a national care system, which is publicly owned, that would really, really help. A lot of times, for every pound local authorities spend with care agencies or other private firms, as Prem said, 40% or even more sometimes is not going towards care, it's going towards their business overheads or their profit. And so this is why I joined this campaign to end the social care disgrace and to get free care run by the public. Back to you, Tony.
Thank you very much indeed, Don. So the really good speakers we've had so far, 3 of them, Rachael and Joe and Don, have given us first-hand accounts of the life of disabled people and carers. Another really important, hugely important part of this picture is what Ali Treacher is going to talk about now. And Prem referred to the fact that there's 1.6 million staff who are paid care staff, but the way they are treated is a disgrace. Ali is a Unite member and working for Unite and Care and Support Workers Organise, one of the founding members of this new organisation. She's going to talk about the care and support workers' experience and what needs to change. So welcome, Ali. Thank you.
Thank you, Tony, and thank you for all the other speakers. I mean, there's been some incredible contributions, and there's so much experience on the panel, but also in this room. So it's a real honour to be asked to speak tonight. So my name's Ali Treacher. I've worked in social care for most of my adult life, and I'm currently working for Unite, supporting the work of organising in the sector and unionising the sector. So as we've discussed, social care is broken, and it has been for many years. It remains privatised, disseminated by financialisation, fragmentation, and it's poorly regulated. We know that services aren't good enough, and unfortunately there's no shining example of when social care was adequate. We just need to listen to our disabled comrades and the carers on the panel tonight to hear that. We need to, social care is often scarce, and reliant on poorly trained staff, and doesn't offer choice or control, which we all deserve. A radical rethinking of how social care is provided is required, and we must think beyond the scope of older people's care and issues around bed blocking. This must look at support for disabled people, kids with additional needs, working with people with addictions, and supporting those experiencing mental distress. Workers in the sector must remember why we came into the sector and battle not just for workers' terms and conditions, but for services which our communities require and deserve. Social care remains the unsolvable public policy, with countless governments passing the hot potato, as opposed to making fundamental changes required to ensure adequate provision for people to live comfortably and realise their true potential. After Johnson's claims of fixing social care with the social care levy, just months later, Jeremy Hunt, in his autumn statement, U-turned, pleading poverty and postponing any implementation of changes until 2025. Not a single penny of new money is trickled down to social care, and all the hope that the true value of our work, which we proved throughout the pandemic, would be seen and remunerated, has been lost. The realisation that there's no change on the horizon. Many of us, of course, were dubious of the Deal Not report and saw these changes as grossly inadequate, focusing only on capping the expenses of social care rather than improving provision and addressing the needs of the workforce. Saying this, something is better than nothing, and nothing is what we've landed ourselves with. I'm going to concentrate mainly on the problems of the workforce, but it's a bleak situation. So I am going to end with resistance as well, these meetings are so important because we need to be envisioning of what support services must look like moving forward, but also bolstering the resistance of workers and disabled people pushing for change. There's over 165,000 vacancies within social care, and the sector remains plagued by precarious contracts and low pay. 165,000 vacancies isn't just a number, it's an empty space. It's a workforce pushed to the brink. It's understaffing to the extent that safe service provision is at risk. It's caseload so big that staff are burnt out and sick because of their work environment. Just last week, I spoke to a worker at a drugs and alcohol charity who explained that she had a caseload of 65 complex individuals needing many requiring scripts and daily medication. She was in tears whilst she explained that she had worked in the sector for 22 years, but the job was causing her to have both physical and mental conditions. And she apologetically wept while she said, just Ali, I can't face this anymore. My nerves are shot. This isn't just one worker. This is 22 years of experience. This is a lifetime of knowledge and gained skill. And this is another in the growing number fleeing the sector because these jobs are untenable. Turnover remains disgracefully high, with nearly 50% of the workforce leaving within the first year. This is the bleak face of it. I want to turn to resistance now and highlight the Unite members and support workers at Hestia who are going out on strike next week. These workers are striking over unsafe caseload numbers, bureaucratic expensive procedures and low pay. These workers have caseloads of 15 to 20 individuals when fully staffed. They've never been fully staffed. The workers are also striking because their unique skills are never recognised. And these workers aren't just support workers, they're now translators too. This work is systematically ignored by the employer, who refuses to recognise their worth. And the workers are taking 2 days of industrial action in London on the 12th and 13th of December. And it'd be really great for message of solidarity and, turning up to their pickets in London would be great. These workers are an example for us all. And I'd like to add my unwavering solidarity to all those workers at Shelter, the housing charity, who offer housing advice for those facing insecure housing, homelessness and eviction, who have started a 2-week strike today, and there's been picket lines across the country. They are striking following the shameful imposition of 3% increase, leaving many of the workers themselves struggling with rising rents and not being able to afford to heat their homes. And I'd like to end on this point, that we should not think of social care as a service which is done to us. Social support must be the fabric of our communities. Access to transport, green space, community space, and advocacy and advice services for all. Social care is not a one-size-fits-all. It's an intricate puzzle, and the guiding principle of us unpicking this intricate puzzle must be meaningful co-production. So thank you very much for having me on this esteemed panel, and it's been incredibly emotional, and I look forward to building that resistance with you all. Thank you.
Thank you very much, Sally. Thank you very much. Very powerful messages again. Oh dear, thank you. So the 12th and 13th of December in London. If you have any more details, put them in the chat later on. I think we should indeed give a strong message from this meeting, and I'm sure nobody would disagree with that. So I don't know if you'd like wording of that, or just the sense that we all support you in that struggle. I'm going to go straight on to Margaret Greenwood now. Margaret is Labour MP for Wirral West, an MP since 2015, going into politics through activism in defence of the NHS against the Health and Social Care Act in 2012. She's been a fantastic supporter for campaigners in defence of the NHS, and is in fact was one of the leaders of the main private members bill sponsor of the NHS reinstatement bill in 2016. She is now also a strong supporter of our End Social Care Disgrace campaign. So welcome, Margaret. Thank you for speaking.
Thank you very much, Tony. And can I just start by saying, you know, how powerful all of the contributions have been this evening, and how important that they are. So I'm really pleased to be here with you. Of course, as other speakers have said, you know, social care is something that either affects all of us or will affect all of us, or the vast majority of us at some point or another in our lives, whether that be us ourselves personally or family members or people that we love and care about, and people who become unpaid carers at short notice. So this is a universal need that we all have, and yet we don't have a solution for it in government policy. There's a huge volume of unmet demands. So earlier this year, it was reported that more than 500,000 people in England were waiting for an assessment for care to begin, direct payments to be made, or a review of a care plan. That figure of 500,000 was up from just under 300,000 the year before. So clearly this is a situation that is bad and is getting worse. I believe, as people on this call do, we need a national care service that puts people's needs at the heart of the process and that treats everyone with respect. But what we actually have is a care marketplace with the pursuit of profit embedded in the system. So while care workers work incredibly hard to do a really difficult and skilled job on low pay, the system in which they're working has not been constructed with the needs of residents at its heart. I want to give an example that illustrates this. So a constituent spoke to me a few months ago about how when her father was near the end of his life, he needed a care package. However, none was provided because no provider bid to meet his complex needs. So at the end of his life, his needs were posted on an online portal for providers to bid for. It's just a shocking scenario, isn't it? And none came forward. So instead of there being a care service to meet the patient's needs of how complex they are, there's a system whereby providers bid for patients who they wish to care for. So we need a care service that put patients at the heart of things rather than one that's built around the business models of providers. And as Prem was speaking previously, so many homes are owned by private equity firms, and there are real concerns about those that fail to provide acceptable levels of care to residents, where clearly if profit is your primary objective, it's almost inevitable that that will be the case. So as has been mentioned, we've got a staffing crisis in the sector. It was reported a few months ago that because of this crisis, there have been vulnerable people in care homes being left alone in rooms for 24 hours and denied showers for a week. Issues with recruitment and retention of staff in social care sector have been widely publicised. So there's around 165,000 vacancies currently in social care in England. It's extremely concerning, especially when estimates suggest that England will need close to 500,000 more care staff by the middle of the next decade. It was reported recently that the average hourly pay in the independent care homes in England in 2020 to 21 was £9.1p. That was the latest period for those figures to be available. So those compare with those of people working in coffee shops getting over £10 an hour, and in warehouses earning between £10 and £12 an hour, and some supermarkets paying more than this. The Social Care Select Committee in Parliament has acknowledged that pay is a crucial factor in recruitment and retention in social care, and social care providers are consistently being outbid by the retail and hospitality sectors. That's so shameful, isn't it, that you know, this is acknowledged in Parliament and yet we're not seeing action on it. That Select Committee report also warned in relation to retention of staff that whilst pay increases are sorely needed, merely raising wages is not enough. A long-term sustainable strategy is needed, which includes the prospect of pay progression, professional development, training and career pathways. On the issue of recruitment, it noted that wider market forces, including the rising cost of living, a lack of affordable housing and a lack of public transport in remote locations, are having an impact on the recruitment and retention of health and social care workers. And I think we can all recognise that, and it is this lack of provision of care, but also for the you know, the working conditions of people in the sector. So the government's recent autumn statement, the Chancellor announced, he said, up to 2.8 billion in 2023-24 in England and 4.7 billion in 2024-25 to help support adult social care and discharge. But there was no detail about how much of that money will be used to tackle staff shortages and improve retention. Now, at the Labour Party conference earlier this year, the Shadow Health and Social Care Secretary, Wed Streeting, said that under a Labour government, care workers will be guaranteed fair pay, full rights to work and proper training. This is welcome, and it's at the very least that the government themselves should be guaranteed. The money that the government announced for social care in the autumn statement includes money specifically for what they called getting people out of hospital on time and into social care. Now, the issue of hospital discharge, I believe, is fraught with difficulty. Of course, we all want to see people discharged when they're ready to be discharged, but those who need social care need to be able to access it straight away, and they need to know that it's the right care for them. So while nobody wants to see people in hospital longer than they want to be, if patients are discharged too simply because of a desire to free up beds, which, you know, there's a big narrative around this, isn't there? Their conditions can worsen and they can come back into hospital again soon after. And you can also have situations where family members are being asked to look after people who they don't know how to look after because they're not equipped to care for them. This is something I've spoken about in Parliament on a number of occasions in the Government's Health and Care Act 2022, or bill as it was, which enables local areas in England to adopt a discharge model known as discharge to assess. So under this approach, hospitals are able to discharge patients before their social care needs assessments have been carried out instead of after. The explanatory notes that accompanied the bill stated that requirement to carry out assessments before discharge has resulted in some individuals experience delayed hospital discharge as they wait for their assessment to be carried out, meaning the appropriate transfer of care cannot take place when a patient is ready to leave hospital. Of course, it's missing the very obvious situation where there's insufficient care available. So delays are very often due to shortages in the social care workforce and the lack of available support for people, either in care homes or in their own homes. In the passage of the bill, the Royal College of Nursing warned about discharge to assess that they said without assurance around registered nurse staffing levels, including in social care and or community settings, this cannot be implemented safely given the current state of the system. So I believe that we need to solve the issues around workforce and staffing crisis before something like discharge to assess can be implemented safely. Unfortunately, it's on the statute and it's happening now. I'm concerned about it having serious implications for the health and well-being of patients and for the many millions of unpaid carers who may be left to pick up the pieces and take over the care of their loved one once they've been discharged from hospital, regardless of any continuing health and care needs that the person who's been discharged may have. Discharge to assess has been taking place throughout the pandemic under temporary provisions of the Coronavirus Act. There had also been some pilot schemes in various parts of England since 2016. However, now this is put on statutory footing. In May of last year, I asked the government how many of the 4 million patients discharged under discharge to assess since the Coronavirus Act of 2020 had been readmitted to hospital in 30 days. And the government said that they didn't hold the data centrally. In other words, they don't know, nor do they have any interest in understanding clinical outcomes of this policy, despite the fact it is likely to affect millions of vulnerable people. I believe it's vital that the data is collected and made public, given the implications for patients and unpaid carers, and so the effectiveness of the policy can be assessed. An independent evaluation of discharge to assess from April of this year notes that what has been achieved by the discharge to assess approach throughout the country is a mixed picture, and then they don't expand on it. But this does suggest that they have nonetheless hinted at problems with the approach. And so we need more work to be done on this to ensure the safety of the policy that's being pursued. Turning to just the Labour Party position, I was very proud to stand on a manifesto in 2019 that pledged to build a comprehensive national care service for England and provide free personal care. That manifesto pledged to provide community-based, person-centred support and underpinned by the principles of ethical care and independent living. So this national care service has long been an ambition for Labour. I'm conscious of the time, so Tony, do you want me to maybe speed up a bit?
if you've got a couple more minutes, will be fine.
Okay, smashing. Okay. So one of the final acts of the last Labour government was to publish a white paper on building a national care service. But of course, we lost the general election in 2010, and that paved the way for the Tories and Lib Dems to set about their own reforms and bring in the Health and Social Care Act 2012, which was, of course, a big privatising piece of legislation. Over the summer, we're streeting Shadow Secretary of State Work and Pensions, and that's Labour will aim to bring in a national care service in England with just as much ambition as the 1945 government brought in the NHS. He reiterated that at Labour Party conference. Fabian Society is looking at how such a service will be funded and structured with a view to bringing it in over the course of several parliaments, and I recognise the comments that were made earlier. I think it was by Rachael about this, which she said, you know, we need care now. So it is a long-term ambition, but you know, I do believe this is going in the right direction. One of the things I would say is that people have made so many really valuable contributions. The Labour Party has a national policy forum. It's currently closed, but I understand it will open again next year, where anyone can put down policy ideas and things that they think are a priority. And I would urge everybody in this campaign to get involved in doing that when that reopens. We have a real sense of urgency that we need to make the case for a national care service. And I think some of what Prem was saying around some of the difficulties was absolutely spot on in terms of saying that it's up to us to make the case and make the demands. And I would urge people to contact their members of parliament, ask for a meeting with them or ask to speak to them on the phone and put forward, you know, why it is that we believe that we need a national care service that is free to all who need it, paid for through direct taxation, and one that treats people with dignity and respect, and enables them to take their place in whichever community they choose to live in. Thank you.
Thank you very much, Margaret. Thanks for speaking and for your offers for ongoing support. I'm going to go straight on now to Gordon Peters, I beg your pardon. Gordon Peters, who's an ex-director of social services and a long-term campaigner for co-production. He might talk about progress in Scotland and Wales and how that's relevant for the way forward here. And you've got a couple of slides which you'd like me to show, Gordon. If you want me to do that, I'll start sharing when you tell me to.
Okay, thank you, Tony. Hope you can hear me all right. Yeah, thanks.
Yes.
Well, I'll try and be brief within my 5 minutes if I possibly can. I came into social work just after the 1970 Social Services Act, which, believe it or not, promoted a universalist approach to social care, with many, if not all, services free. Now, just think how far from that we now are. In the last 10 years, we've lost so much, diminished actually from social care, and the invisibility, the discrimination and the fragmentation, which has been described so vividly up into, by the previous speakers, leaves us in a very, very different and much worse position than when people like myself started. We need a new legislative approach altogether. Social care is not a burden, it's a fundamental right. Even a firm of city accountants have worked out that spending on wages and social care actually contributes 2.5 times the cost of the wages to the national economy. And yet somehow it's still put around in the mainstream press as if this was a burden. So we need a new legislative approach with 4 basic principles. I think equality, a universal right, diversity, nobody excluded, accessibility, no barriers, no means tests, and co-produced with users and carers, and reciprocity, nothing about us without us, as users and carers organisations often say. What would that look like? Well, if Tony shows the first and then the second slide, I can give you an idea of the principles involved. The Carers Trust, believe it or not, have put forward the proposed National Care Service in Scotland as a model in terms of principles. So if we can show the next slide, Tony, and quickly go through what these are. There we are. And the Carers Trust, and I agree with them, say that these are as good as you can get for a national care service. The question is they have to be put into practice. But nevertheless, this is now going to become law in the Scottish Care Bill, which all the parties there, although they differ on the implementation, agree with these points. Embed human rights and care support, increase equality and enable people and communities to thrive, ensure the national care service, however it's distributed in its powers, is an example of fair work practice, effectively co-designed service with people with lived and living experience, ensure that the care workforce is recognised and valued, improve outcomes through prevention and early intervention, getting away from the whole notion of crisis, provide financially sustainable caregiving security and stability to people and their carers, something that we know only too well doesn't happen at the moment, and ensure that the National Care Service communicates with people in an inclusive way. What they're actually doing, I'll say something quickly about Scotland, is they now have a bill in Parliament there, which is to be put into, go through the legislative process by 2025. All the parties agree that there should be a bill. The Labour Party have different questions about it to the SNP Green Coalition there. But they do all agree in the main tenets of having a national care service free at the point of need. It's in the policy memorandum for that says that they should shift the paradigm from burden to investment, from crisis to prevention. They should strengthen the foundations and value the workforce with terms and conditions appropriate to that, and support unpaid carers and enhance the voice of carers and users. They also say in their policy memorandum that it's needed to reduce the gap between legislative intent and delivery, which is very interesting to see in an actual piece of legislation, admitting that it's all about implementation. And it will enshrine a right to breaks for carers and a right to have key visitors for residents in homes, and a commitment to co-production. And in that bill, they propose a school for co-design, which professionals and experts by experience, i.e. users, would actually take part in. And they also propose a steering group with users and carers on the whole implementation process, and a social covenant which people sign up to. In other words, everything would be written down and accountable in terms of provision. In Wales, they're putting forward something similar. It's a shared ambition for social care and a desire to have a national care service, which the Plaid Cymru and Wales Labour Party jointly have a shared ambition for, and what they call a cooperation agreement. And that's between 2022-25. And they're also going for parity of recognition and reward for social care and healthcare workers. The Scottish bill doesn't quite say that. The Welsh, in some ways, if it comes into being, goes further and actually recognises parity with the NHS as fundamental to a new care service. They have a terms of reference and an expert group which is charged with making it free at the point of need and continuing as a public service, and also having the aim to increase the percentage of publicly delivered care, and to increase the role of local government ownership and cooperatives. And the Senate committee, which is cross-party, is now finding ways to put that into practice. So already there is a consensus on public delivery and social care in Wales, which they haven't quite got in Scotland, although the Scottish bill is in other senses more ambitious. So that shows you where we could be, even in the current straitened financial circumstances. The next slide is about how do we get there? Well, we need a movement in England, I think, for a universalist approach, which, as I say, would not actually be new, but it would be nice to have one in the current circumstances. And if Wales and Scotland can do it, surely we can have a movement in England which can bring about the 7 demands in social care disgrace, which are: the government shall have responsibility for and a duty to provide national care support and independent living service. And it will be fully funded through government investment and progressive taxation, free at the point of need, and fully available to all living in the country. Publicly provided, publicly accountable. And that means not-for-profits and cooperatives, but not the market within that. Mandated nationally and locally delivered. And identifying and addressing the needs of informal carers, family and friends providing personal support, and having a national employee strategy fit for purpose. That would, for instance, at the moment mean something like a minimum £15 per hour wage, and supporting the information of a task force on independent living. Now, in an inclusive way. So the last slide I have is, how do we get there? Well, we need, I think we need, there's another slide, Tony, I think. Yeah, we need a draft bill to be ready for 2024, clearly. And I would go much further than Wes Streeting already referred to, as Shadow Secretary has said, over 3 parliaments bit by bit. That is not the kind of approach. That's a fragmentation approach. We need surely a new legislative approach with some ambition, and a cross-interest alliance within to bring it about. That would include in social care disgrace, the National Pensioners Convention already signed up to a universal service, the disability groups like Disability Inclusion and DPAC and others, and the carers organisation like Carers UK, and unions like Unite, GMB, Unison, PCS, and indeed the Independent Workers of Great Britain, all of whom organise within our sector. Interestingly, the Labour Party conference policy actually asked for something like this, and citizens' assemblies, when they've been asked, have come back always with the same response. They want a universal, free, at the point of need social service. So it's vastly popular in every way in which it's been tested. In the first year, we should ask a Labour government to have public service contracts reintroduced, local authority capacity repaired, to boost the pay and conditions on the lines that we started to outline, and parity with the NHS at very least, to have a free personal care, which Hammersmith and Fulham already can do, even in the current straitened circumstances for people receiving home care, and to co-produce and have co-production embedded, working with users and carers on the design and the delivery of a new national service for care and support for independent living, and disabled people's organisations to help bring that about. Stop continuous care reassessments, which are these which make the lives of people with long-term conditions often and their families miserable when they get reassessed for possibly having to pay through a local authority mechanism rather than have an NHS free form of care. That needs to be completely abandoned in the first year. And care benefits should be inflation proofed, and clearly a long-term plan produced for something like 10 years development. And all this could be encompassed in a new bill for a national care and support for independent living service, at least as good as that being outlined in Scotland and Wales. And England should no longer be the poor relation in all this. It's embarrassing, to say the least, for those of us who've been in social care so long, to feel that despite all our best efforts, the politicians and the others are letting us down. At least Labour Party is beginning to pick it up, but I think it needs a huge boost on the lines of what people have said earlier today, and a new bill and a new ambition in a new parliament, and that could be got ready for 2024 with the possible cross-party and certainly a cross-group alliance and mobilisation from the base. So I'll stop at that point.
Thank you very much, Gordon. It's both bewildering but also encouraging that other countries other than England can get their heads round at least halfway towards a decent set of proposals. We're running a little bit late now. I hope people might be willing to stay on a few minutes longer if you're willing to do so. I'm going to go into questions or comments now. I'm going to ask people to stick to a very maximum of 2 minutes to either ask the question or make a comment. Claire from Winvisible is first off the mark.
Thank you. It was about the approach to what we want. There's often been a very sort of bureaucratic, top-down, sort of corporate equality agenda type thing, you know, saying it's bad for women to be dropping out of the waged workforce to care for relatives. It's not a problem unless unwaged carers face poverty from doing so. And women deserve a care income, not only for family caring, but also as mothers. And disabled people want choice and not a huge megalith of fused NHS and social services that patronise us and don't let us make our own decisions. So, you know, the funding is there in the military budget and other places, and but it needs to be humane and not a kind of prescriptive top-down policy making.
Thank you very much, Claire. And that kind of approach is partly outlined what Gordon's just said, and also what we in our campaign is arguing for, that it shouldn't be top down, it should be bottom up and partnership. So please do work with us, which I know you do. Next, I'm going to invite Helen Rowlands to speak, and then Mike Hope.
Okay, thanks. So just two points that I wanted to make. The first is that, as many people on the call will probably know, Unison have funded the Fabians to produce a national care service report for the Labour Party. Disabled people-led organisations push them quite hard to make that process properly co-produced. They declined to take us up on that, and they did consult on it, but no, it was nowhere near co-production. What we know in advance of the publication, which is due out at the beginning of the year, is that they are not going to be calling for universal provision of social care until 10 to 15 years of a Labour government. It's completely unacceptable, and we are disappointed that that one of the major trade unions would be backing that, and we'll see what Streeting says in due course, but we believe that is his position, and that's kind of unsustainable. On social care charging debt levels, which are rising in every local authority apart from Hammersmith and Fulham, which doesn't have charging, there are things that people can do to lobby local authorities in advance of the April 2023 budgets, which will assist disabled people who are currently being charged and being pushed into arrears. So people on this call could, for example, ask their local authority to freeze care charges for the 2023 budget. They can call for a waiving of existing care charge debt. They can demand the end of the use of debt recovery agents to recover care charge debts from disabled people, and they can call for a ring fencing of the household support fund, which can then be used to assist disabled people who have fallen into poverty because of social care charging. Thanks.
Thank you very much, Helen, and thank you for being so succinct. We're going to be running over, but I'm going to keep going for at least a few more minutes. I've got Mike Hope next, and then Wanda.
Right, thanks. Yeah, no, it was originally, excuse me, I'm croaky, I've got a cold. It was originally a question I was going to ask Prem Sikka, but I fell off the end of the list. So I'll ask it, I'll throw it out to everybody. And I think Gordon touched on it to some degree. But it is really, the question is, how do we begin to frame the argument that social care is not a drag on profits and on society, which is the way that it's traditionally been always presented, but is actually potentially a wealth creator and a well-being creator? In other words, how do we frame the argument about well-being? Because, you know, I think that's crucial for winning this. And, you know, in the light particularly of what we've just heard, which I suspected, you know, that's not just thrown at Tories. You know, the likes of Wes Streeting and Keir Starmer, you know, will pick this one down the road. They frankly don't see it as very important. There's not that many votes in it. People don't talk about social care on the doorstep, do they? You know, and grief is individualized. We need to make sure that the consequences of this are socialized and that it becomes a #1 priority. But I'd really like to hear how we begin to frame this argument, what people's thoughts are.
Right, thank you very much. And I suppose part of the answer is that we should start framing it in that way. The content of it, some of the speakers.
Yeah, how do we do it?
Yes, of course. So I'm going to go on to Wanda next and come back to the speakers later if they could pick up the questions. I know Don's you've got your hand up. Wanda.
Yes, I just wanted to quickly mention a case of a friend of mine. She's practically bedridden with ME, and she's been allocated 2 sessions of 15 minutes per day, which isn't enough to do anything. Now, fortunately, she's got a teacher's pension, so she can pay for an extra 15 minutes. But even so, two slots of 30 minutes just isn't enough. And basically, it's not enough to give her a meal. She can't cook for herself. So they just prepare something quickly that can be microwaved, which isn't very good for nutrition. And obviously, there's no chance that she can, you know, her health can actually improve if she's not getting the proper nutrition. Now, we're part of the Gloucestershire County Council, and my understanding is that the largest part of the council's budget goes to social care. So basically, we just need the government to give councils more money so they can afford to pay for the care that people need. I just wanted to make that point. A brilliant show, and Prem Sikka's wonderful, and really what he says ought to be publicised more widely. Anyway, thank you very much. Thank you.
Thank you, Wanda. And there's obviously no end of awful stories that need to be heard, and that's part of what the campaign needs to do to get the truth out there. I'm going to take 2, possibly 3 more. Maral is next. We're not going to be able to take everybody, I'm afraid, but Maral Nosrat. Are you able to speak, or should I go on to the next one? Okay, Jennifer Dunstan.
Hello. Sorry, I have my phone in my hand while I'm listening. There's a lot of things that people who've just spoken have already said that I would have touched on, so I won't waste everybody's time, but only can support and echo what's already been said. Firstly, a big thank you to Rachael for representing us at Disabled People Against Cuts Sheffield so incredibly with their amazing speech. Thank you ever so much, Rachael. I myself am a disabled mother, and I have a disabled child who's been disabled since she's been born. And I think that when we're having these types of forums, something that doesn't get touched on so much are disabled children. I mean, indeed, some families, you know, their babies are disabled people and need social care from birth. We need to remember that too. But one thing that I'm really annoyed about with the social care that's provided to my son, and is a really important point, indeed Rachael and others have touched upon this, is that when councils are outsourcing, while we're campaigning for these things to be brought in-house, or even to become part of NHS again, which indeed they should be, part of our campaigning does have to be to demand that the companies that local authorities are outsourcing to are not having 0-hour contracts with the staff. We see a very high turnover with the PAs, stroke carers, support workers. We see a very high turnover because people aren't getting enough, these people in these roles are not getting enough hours. They're paid a minimum wage, not paid in between house calls, etc., etc. You all know how it goes. So we have to be demanding, as people who are using these services, along with the things that we need as service users and for our own autonomy, we also need to be demanding that the conditions for the people working with us and for us are the best that they can be as well. But let's not forget the babies and children while we're talking about this. And thank you so much to Winvisible for also, you know, just compounding that fact that so many of us can't work because we have a disabled child or family member, and the duty of care does fall to us. And yes, we should be on a wage for it. And by the way, just finally, for those who don't know, carers allowance, it is a pitiful amount. But if you're somebody who can't work because of the how many hours you have to care for in a week, you then will be on ESA or income support or the new universal credit. You then only get half of what carers allowance is. You don't even get that £60 odd a week. It's more like 30. So it's pennies per hours for a 24/7 job. So to all of the carers out there, solidarity, and to all of you, solidarity, and thank you so much for your wonderful meeting.
Thank you very much, Jennifer. Thank you. That's a great contribution. I'm going to go back to Margaret now, who and try again. You're muted at the moment, but for some reason I couldn't hear you.
Hello, can you hear me now?
Oh yes, we can. Just speak
Hi.
a little bit louder if you could.
So sorry for this. I just have a question. I'm a disabled person myself. I'm a wheelchair user with severe cerebral palsy, and I'm also currently a student at the University of Leeds doing law. I was sort of pushed to, after finishing my degree last year, I was pushed to go to a care home because they wanted to cut my care package. And after a year and a half, I kind of win the battle through the role of advocacy. And from this brilliant event tonight, do you think within the reform, because we said we need legislative reform, but do you think within the reform we need also a role of a sort of rights protector officer as opposed to social workers who can be your advocates to access your rights, whether that's independent living or any aspects of your social care, as opposed to some of the social workers who don't push for your right and don't advocate you, but rather see you as a burden on local authorities, because that was what I was said. It was said to me that I shouldn't pursue with my education and with my PhD because my care package costs a lot to the local authorities, despite my needs since birth of 24-hour care, basically.
Thank you very much, Margaret. So I think Don partly talked about this, that the disabled people's organisations need to be involved in partnership with local authorities to protect people's rights. But and of course, if the whole system was less neoliberal and aggressive, the social workers could actually play the role of defending the position of people who are in need of services. But whether or not we need rights protecting officers, that would be a very strong proposal. I'm going to take two more. Well, actually, I'm going to take one more because then we need to ask the speakers to come back. So I've got one more speaker in the lineup, is Dr. Hitesh Kumar, who's muted at the moment.
Hello, good evening. My name is Mr. Lakhar. I need NHS help. I emailed couple of times NHS England, but I haven't got any help from. I am a victim of modern slavery and
We can't hear him, Tony.
I'm sorry, but I can't hear you, Dr. Hitesh Kumar.
Can you hear me now? So what I'm telling, I need help from NHS. I couple of times email you also NHS. I am a victim of domestic abuse and modern slavery. So would you please help me to get justice for me? And I am a victim of human rights breach as well. So
Please, could I ask you to put your email in the chat?
Yeah, I put already.
Yeah, okay, because I'm afraid the line is very. I definitely heard part of what you said, but not all. But thank you very much.
Yeah, so already wrote down my email. So please reply me. Help me. Really
Okay,
help.
well, I will do. I'll email you tonight.
Yes.
I'm going to go on now to ask the speakers if they could pick up. Sorry, somebody's on, needs to be on mute. I'm going to ask the speakers if they got any comments. Don, you've got your hand up. Sorry to everybody else that hasn't been able to take. I haven't been able to take you, but perhaps you could put your questions quickly in the chat if that's appropriate, or your comments. I'm going to go to Don first.
Just talk about what Rachael said, the idea that advocacy is so important. And you hear horror stories of people who have their care taken away or have their care reduced purely because they can't fight for their rights. Care is not a postcode lottery. It's more of a lottery of how belligerent you are to get the care you need. And it's a real shame it has to be that way. Because once someone gets the care that they actually need, someone else in that local authority probably gets less care, because obviously they have to balance the books in some way. But essentially, advocacy is so important, just to make people aware of their rights, but also to help fight for their rights, and also to make sure that people don't lose the care they actually have.
Thank you, Don. Gordon, you had your hand up.
Yes, 2 quick points, if I may, Tony. I think mainly to answer Mike Hope. One is jobs. It's social care is unquestionably the biggest area of increase in jobs in the next 10 years. Skills for care say 450,000, Unison say 650,000 minimum, just to keep things going as they are, never mind meet needs that are not met. So it's a huge area of job increase. So it has to be important economically, and for people to realise while jobs are scarce and automation's getting rid of jobs and so on. The second point is that we need to challenge the neoliberal discourse much more aggressively and out front. Without civic responsibility and health and well-being for all, things fall apart, as things have been falling apart for all sorts of people, as well as those with current social care needs in the last few years. So we need to reintroduce the notion of civic responsibility and health and well-being for all as part of the discourse against this neoliberal individualism. And people like us are in a very good position to try and do that with any contacts and any media that we have access to. That's it.
Thank you very much, Gordon. I'm going to go to Margaret next, please.
Thanks very much. Really interesting comments and questions. One of the things, it sort of follows on from what Gordon just said, really, but when Mike was talking and he talked about the importance, I mean, he alluded to this, of getting MPs to see the value, the votes in it, if you like. And it's about building a story that people will understand and hear. So it is about kind of challenging the neoliberal way in which everything's organised, but of course not using that language, if you like. So it's using a much more personal language. And I think that it needs to come from within communities that, you know, there are so many radio phone-in programs, there's so many local papers that people can write to. People think about particular things that they want to campaign on. You know, you can actually start to have an impact on how people talk about these things. I was struck the other day. I went to visit. I was in a hospital doing a visit, and there was a local. And actually, I can't mention him, can I? Because that would reveal him. But anyway, I've had conversations, really, maybe perhaps with people of different political persuasions than myself, who've been saying, "Oh, I can't work out. You know, civic society, everything's falling apart." And you think, well, yeah, there is a reason for that. And I think that there is such recognition now that, you know, the society isn't working for people generally. We've had such huge cuts to public services that I actually think that there may be a sort of opportunity to start describing things in the way that we would like them to be. So because we have we know that we've got lots of people who are living an awful lot longer, but people are very preoccupied with whether or not they themselves will need care. Actually taking those opportunities in local communities to talk about, you know, what's needed I think everyone can get involved in that. And as I mentioned before, it's important people to speak to their members of parliament about it and just describe what it is that we want. Because until that becomes commonplace, then I think, you know, it's difficult to get traction until it becomes commonplace. And yet it is such a fundamental need. It's really the elephant in the room, isn't it? You know, all of the talk that you will get from government about the need to release people from hospital beds fails then to say, oh yes, and we need to address social care, and actually we need to be ambitious for it. So really it was just to encourage people to carry on talking about it and talk to people within our own communities about it and say, look, you know, we need to be asking for this, because until we ask for it, you know, it won't happen. And again, to just say to people, put things on the National Policy Forum of the Labour Party, because I think that would be useful. Jennifer mentioned calling for an end to use of 0-hour contracts for companies that local authorities use. And I think that those sorts of campaigns can be incredibly useful. In Wirral, the local authority decided that it was going to be paying the real living, you know, would give money for the real living wage to be paid for care workers. And that was a very, you know, it was a successful campaign locally. We need more of that sort of thing. But those sorts of asks in which have at their heart as well, raising the profile of the importance of the roles that people who work in care do, I think can be very useful.
Right, thank you very much, Margaret. I'm actually going to ask Mike Smith if you want to have a quick word, but it would have to be quick, Mike. If you can, you work for Wirral, the disabled people's organisation in Tower Hamlets, and you've been involved in a report the House of Lords is about to publish. So on that basis, I would really like to hear from you. But if you could be very brief, and then we could follow it up outside the meeting, perhaps.
Yes, of course. The House of Lords have been doing a review of adult social care for about the last 9 months. I've just posted a link to the committee website. Wirral is the youth-led organisation of disabled people in the London Borough of Tower Hamlets, and we hosted their public engagement event. We had about 20 members of the public invited and speaking about the issues, which absolutely mirror the kind of problems that people have been talking about today. I've seen an embargoed copy of the final report, and it goes live this coming Thursday, and it'll be launched on social media and so on as well. The report is not perfect, but it is very critical of the status quo, and it calls for whole-scale reform of the social care sector. And it doesn't, you know, it doesn't take to niceties. There's a lot of good stuff in there. It's not perfect, but it's a step in the right direction. I just think it's really important that everyone who's campaigning on this topic might well be able to use that report when they're talking with their local MPs, when they're talking with their local councillors, and also perhaps their local media, to highlight the issues that we're talking about locally and use it as a way of getting volume and traction in your campaigning.
Thank you very much, Mike. So I hope very much, well done for your involvement there, and I hope we can keep in touch. Before we actually end the meeting, could I just have a word from Joe Walton, please, as one of the speakers, and from Prem, Sikka, who's come back to us. I think you're still here. So Joe first, please.
What I wanted to comment on was the framing of the argument. I know that the last Labour manifesto for 2019 was really well crafted on the principle that nothing is a silo. We live in systems, and that everything that we do influences everything else. And with the National Care Service, absolutely everybody would win, because the economy, local and national, will go up, because there'll be more people being better paid, and will be spending the money in their communities and paying taxes. The NHS will benefit because it will be able to discharge patients who are ready to leave hospital into somewhere they can be cared for, and will be able to get patients in at the other end who need their the higher level of care. It also means that people will be better looked after in the community. So there will be less need for that critical level of care because they won't get as ill and won't need to go to accident emergency. But the real benefits here are to the care users, because their physical and mental well-being will increase exponentially. And when they're happier, the people, their families and their communities will be happier too. So
thank you very much. Thank you, Jo. Brief word from Prem. You've come back to us, so thank you. And then we'll
thank you, Tony. Wonderful discussion. I'd just like to respond to a couple of issues. I think one which Mike Hope raised about how do we make our concerns other people's concerns. And I agree with what Gordon said. We can't be mimicking neoliberal discourses that it's all about wealth generation. There is something greater than that, and that is humanity. There aren't any easy role models, but we can learn a lot from feminist movements, environmental movements, civil rights movements, gay, lesbian movements, who against all the odds managed to make their concerns our concerns, who against all the odds managed to give visibility to things that really matter. So we can learn a lot from them, but I think it would be a mistake to express concerns about humanity in terms of it is all about wealth generation, though there are benefits in terms of wealth generation. Not only are there jobs and orders for businesses, but of course, a lot of people can, as it were, be reconstructed, and they can even become productive workers if we want to go down that line. The second point was about the 0-hour contracts. Now, of course, some people want to work less hours, irregular hours. My colleague in the Lords, John Hendy, who's an employment law expert, has tabled a bill under which workers on 0-hour contracts will have exactly the same rights as all other workers. And he's advocating free collective bargaining so that they get the trade union force behind them as well. I think that is a way forward for them. So other than to say thank you, Tony, for organising, and everybody else who's been involved with organising. And it's been wonderful to participate in this seminar, and hopefully we will revisit the issues soon.
Thank you very much, Prem, and thank you, everybody. I really apologise to the speakers, the questioners that I haven't taken. We're 20 minutes over time, and we started with about 120 on the call, which is fantastic, and showing the interest that people have. There's still nearly 90 people on the call, even though we've run over. Apologise for running over, but there were such important things to hear. Please do keep in touch, and I've put in the email to contact us and the website and other social media in the chat. The information from Ali about the strike next week is in the chat, so do save the chat if you're able to do that. And I want to thank everybody for coming tonight, and hope that we'll be in touch with you in the coming struggles to end this social care disgrace. Thank you.
Thank you.
Bye.
Bye.
Thank you. Bye.
Solidarity. Thank you.
Solidarity.
Solidarity, everyone.
Solidarity to everybody. Thank you.
Thank you, everybody.
Take care,
Special
everybody.
thanks to Tony for chairing. Well done.
Thank you.
And can we leave the chat open? Sorry. Can we leave the chat open a few more minutes in case anyone wants to add a few comments as we all fade away?
That's fine. Yeah, I'm doing that.
Thank you.
And the chat's mailed out.
Thanks for sharing. Thanks for everyone.